My name is Tiana Otsuka, and this is my signature assignment for mobility program for elderly patients. This is my table of contents and my introduction. So this evidence-based practice project proposal presents the comprehensive strategy aimed at addressing a crucial nursing practice issue, which is the mobility and functionality and the independence of elderly residents in long-term care facilities. I wanted to see if implementing a structural daily program that's tailored to this specific population would help improve their outcome and their daily lives. This also not only looks to improve the outcome of the patient, but also helps um, enhance the overall quality of the healthcare delivery system within these settings as well. Enhance functional mobility through a structural daily program can help improve overall well-being and reduce the care burden on each patient and the caregivers. So my PCOT question is, does this implementation of daily mobility program as opposed to standard care without such a program result in improving overall functional mobility in elderly patients, specifically 65 years of age or above, living in this long-term healthcare facilities after 3 months? My background, I looked at different types of evidence-based peer-reviewed articles. Among them many of them had good information about how healthcare workers often hurt themselves when they're trying to help their patients. So by using these programs of functional mobility, they can help reduce the risks for nurses and other healthcare providers by using Hoyer lifts and other mechanical lifting devices. Let's see. Implementing a daily program tailored for these elderly residents in a long-term care health facility is one of the project objectives. We also want to conduct a comprehensive training session for the nursing staff to ensure competency and guide these residents through exercises and monitoring this progress. We want to perform baseline assessments to see where they start functionally and see how their mobility is before starting the program. We want to also follow up with these assessments after 3 months to measure the improvement. Compare outcomes between interventions and control groups to determine the efficacy of the mobility program, and then gather the feedback from the staff and the residents to evaluate the program's satisfaction and feasibility. This also helps us identify different barriers and facilitates for different future strategies. I have a few more project objectives. We also want to reassess the residents' mobility, like I said, after 3 months, just to gauge improvements, and we want to contrast the outcomes with the control group. I want to also gather feedback from the staff and the residents to evaluate the satisfaction and the realistic feasibility of implementing these programs. After we have that information, we can analyze the success and the challenges that encountered from this information, so that when we're employing future strategies, we can optimize the mobility interventions in long-term care health facilities. We also want to aim to improve the mobility and functionality of just their independence for their everyday life, so it can help their quality of life. Method and study design. So quasi-experimental design with a pre and post-test control group has been chosen for this project. This helps us compare between both groups. So we have the control group and then the one that we are going to be looking at just the standard care. So we can use this in a large framework, and we can use this intervention and to see the effectiveness, which is considered confounding variabilities, but it's feasible when it's implemented within real life clinical settings. So intervention. Implement daily mobility program for the elderly residents in the long-term healthcare facilities. Programs include exercises targeting strength, balance, and flexibility and endurance, supported by existing evidence showing effectiveness in improving the mobility and reducing fall risk, and then This aligns with the evidence-based practice guidelines promoting regular health fitness for the elderly individuals for their well-being. To implement the plan, we also need to train the nurses and make sure that they understand what the project aims to do, and we need to allocate resources and establish the timeline, which is 3 months. We need to address any potential barriers for the staff and see if there's any limitations. We need to implement strategies such as ongoing support and education so that if we need to change up the routines, we can. Address potential barriers like proactively with strategies like ongoing support and education. So we just want to support our nurses and make sure that they have the right education that they can implement to their patients and make sure that their patients are getting the right type of care for their living situation. Some of the evaluation methods that I found, so quantitatively, we can use a method that is called timed up and go, or TUG. This helps understand how far the patients can get up and how long it takes for them to move, and it kind of charts how far their distance they are going. And then we also have another one called SPPB, the Short Physical Performance Battery, and that kind of also helps outline guidelines to help guide us and find quantitative measurements for how far they're going, how much trouble they're having, how long it's taking them, and what kind of improvements we can see. Let's see. And then the qualitative methods, we can gather feedback from the staff and the residents by surveys and focus groups and asking them questions and just getting their honest opinion about the exercises. And then, we can just kind of assess with the staff as well and see how easy it was to perform these daily mobility routines for them. And then evaluation methods continued. We do have some ethical considerations. We absolutely need to get informed consent from each of our patients so that they know what they're doing and what they're participating in. Ensure that everything is confidential, so HIPAA privacy rules are being followed, and make sure that the data collection is anonymous. And we also have to adhere to ethical guidelines for research involving human subjects. So we want to make sure we're following all those guidelines so that this study can be presentable and able to be used in further studies and research. Our expected outcomes and implications. So we obviously want our patients their mobility and functionality and their independence to be enhanced. We want to reduce their fall risk. We want to increase their confidence in their daily activities. We want to promote physical, emotional, and psychological well-being. In doing that, we can help with their autonomy and help guide them make choices for their own lives. Empowerment of the nursing staff as well is very important. And we want to really show a lot of just support for the staff and offer a lot of education for them. Professional development, such as, like I was kind of saying, like educational is really helpful, I feel like, for for nurses. And then enhancing the cost and effectiveness, so making sure that they have all the tools that they need that are necessary to implement these mobility programs like canes and walking devices and things like that. We also want to reduce the need for extensive rehabilitation services and hospitalizations. This will help create safer environments, improve patient outcomes, and enhance the quality of their lives. My conclusion. So we address the mobility and independence of elderly in the long care home facilities. We wanted to address the daily mobility programs to improve outcomes and recognize the challenges that come with it and the impact of the healthcare providers, as well as financial restraints. Empower residents and staff with evidence-based tools. We wanted to combine exercises targeting strength, balance, flexibility, and endurance. And then potential to enhance patient safety, reduce cost, and optimize resources. Reflects committed to evidence-based practice and quality improvement. This is my reference page. This continued and continued. Thank you so much and have a wonderful